And so how often do we have to come for a review with you?
Yeah, so we like to see you. It depends how concerned parents are often, actually. So if there's been some really concerning signs, then we might see you back after about 8 to 10 weeks to see if the glasses are working well enough and you've got the glasses and the kid's happy wearing them, you're not having any issues. Particularly if there was difficulty getting into clinic in the first place, or there might be a reason that we see you sooner rather than later. Yeah. It takes about 14 to 16 weeks to fully adapt to the glasses. Yeah. So we probably wouldn't be changing the prescription. If you come back at that visit and your child's eyes are nice and straight and they're seeing well with their glasses, they're happy wearing them because they don't have double vision, they're not grumpy anymore, they're like, yes, this is amazing, put my glasses on, and the vision is equal between the two eyes. Then when they're little, like 2 and 3, I'll probably see them every 4 months. Yeah. And then after that, once things are stabilised, we're sure what we're dealing with, then every 6 months after that, just to check. Because kids grow quickly, their eyes change shape, they might need new glasses.
Right, okay. That's good to know.
Yeah.
And so could I expect that Evie will always wear glasses?
Yeah, so it depends a little bit on the prescription. So if a child's prescription is like +6, that means that their eyeball is relatively short compared to the focusing power of the eye. They've got a lot of growing to do to grow out of their +6 glasses, and often those children would need glasses for their whole lives unless they have some sort of surgical intervention when they're older, like LASIK or some other corrective surgery. If they're like a +3, +2, and at 2.5, and they gradually are growing, then they may grow out of their glasses. So they may absolutely not need them when they get older. If they grow enough that they're just sitting around that +1 mark, it may be that when they're 8 or 9, they choose not to wear glasses. Things will be a little bit blurry in the distance. They're probably not going cross-eyed, and they don't like wearing glasses because they're playing sport and running around. That's kind of on them at that point. They don't have to wear glasses, but our job as doctor and parent that we need them to have good vision until they're 7 or 8, so that they develop all those brain pathways. So as much as it's a battle and a struggle, constantly reassuring parents it's all a good investment, it's really important. And sometimes kids will wear their glasses really well when they start, that they think this is amazing, and then they'll grow and change and the prescription's not quite right. And so if they start being less happy wearing their glasses, often that's a sign to me that we need to bring them back to clinic, put the drops in, recheck their prescription.
Right, that's good to know. So if you find that you try the glasses and they're not helping, what would happen then?
In terms of still having a turn?
Yeah, and would you when would you look at surgery and those sorts of options?
Yeah, so so some children when they put the glasses on makes no difference to the turn. So then they've just got an intrinsic turn, and so usually we don't wait too long before we're doing surgery for them because the glasses aren't helping. If the glasses have helped somewhat and for a period of time they were straight and then they're starting to go cross-eyed again, usually update the glasses.
Yeah.
And then if you put the glasses on and they sort of correct half the turn, so they might have had what we call a 30 diopter turn and it's about 15 diopters, then we might talk to the parents about doing surgery. And the reason for getting on to doing surgery is that this gets a little bit complicated again, to digress into some more ophthalmology. But when you want to look in the distance, your eyes are naturally displaced with 2 images, one from each eye, and your brain locks those 2 images together to give you a sense of depth perception. So you have to have good vision from both eyes, and the images have to be close enough that your brain knows to fuse them together. So if they're completely separate because you're cross-eyed, then you've just got double vision. Yeah. You ignore this image, so you don't get double vision, but you maybe don't learn to see properly. If a child has more than about 10 diopters of turn, they're going to be switching fixation between the 2 eyes because there's too much double vision to try and merge those things together. And so there's a lot of argument about, is it important to treat so that you can get good depth perception? And in someone like Evie, who had good depth perception before she started to go cross-eyed, we've got everything to gain. So say we'd put her glasses on and she was only half corrected, I'd probably have an earlier discussion with you about whether we do surgery to try and maintain her binocular function. But if a child presented at 5 or 6, they're probably not going to regain that binocular function anyway. Right. And so if they had a small turn that looks good with their glasses on, we don't have to do surgery. Generally, they're going to have good vision in both eyes. They look good with their glasses on. We don't have to operate. So that's where it becomes an informed discussion with your surgeon and your ophthalmologist about the risks and benefits of surgery and whether it's worth doing.
Yeah.